Should we get started, Claire?
Yeah, I think we should.
All right, perfect. Hold on, one more person. All right. Um, so hi everyone, welcome. My name is Anushri Kumar, and I have Claire Dunbar here with me, and we're going to talk a little bit about perimenopause. Just FYI, this talk is being recorded. We'll send out a link to the recording after it's over, and also a copy of the slides so that you can have them for your reference. If you have any questions, please go ahead and enter them in the chat box, and then Claire and I will try to monitor it and answer those questions as we go along. Okay, so yeah, like I said, I'm Anushri Kumar. I'm an internal medicine physician with Vita Family Medicine. I grew up in Houston, trained in Texas. One second, I'm gonna let someone else is trying to join. After I finished residency, I worked as a hospitalist for a few years with Methodist in the Med Center and then switched over to primary care. I joined Vita Family Medicine last year, and we are a membership-based practice. We don't take insurance, and our patients pay a monthly fee, and in return, they get unlimited visits, televisits, and longer, more holistic care, same-day access, and unlimited care from their physician. Now I'll just turn it over to Claire really quick, and she can introduce herself.
Yeah, hi everybody. My name is Claire Dunbar. I'm also located in Houston, Texas. I grew up in Sugarland and excited to be back here. So my background is in nutrition. I studied nutrition and dietetics for my undergrad and then for my master's. I love nutrition and I love science. And as I was working with women in nutrition, really noticing a need to zoom out and look at a holistic, whole person approach to finding healing and walking on a health journey. And so now I do holistic health coaching. That's kind of a weird word. Sometimes people are like, what does that even mean? But it's really supporting the whole person in whole person health. I still do a lot of nutrition, but also incorporating different aspects of health and walking with people in implementing those lifestyle changes to be supportive for where they are right now and where they want to go. So I'm excited to be here with you and to be working with Vita and Dr. Kumar is really fun.
Great, thanks. Yeah, so as a physician, I became interested in menopause because this is an area of medicine that's rapidly evolving, and there's just so much unmet need. In my work through the years, I really got to appreciate how all of us, men and women, go through so many changes during our 30s and 40s that really set us up for our health as we age. And in females, perimenopause is a huge part of that, and the way that our hormones evolve and the way that it impacts our health, not only our quality of life, but also, just our numbers, our cardiovascular disease, dementia, et cetera. It's just fascinating. There's not a lot of physicians out there who are well trained in menopause and perimenopause. It's just such a rapidly evolving field, and I'll be honest that it's not something we learned about when we trained. And it really requires going out of our ways and training and gaining experience with patients who are experiencing these symptoms to learn about more about menopause. So just a few definitions. So perimenopause is a natural process when the ovaries gradually stop working. So as ovarian function declines, hormone production actually becomes dramatically erratic, which causes a lot of our symptoms, such as irregular periods, hot flashes, mood changes, that plague women during this stage. Menopause is defined as the point in time when a woman has not had a menstrual period for 12 months. So that means that keep getting people who are trying to join the call. Sorry, guys. Let me just let them in. So menopause, hi everyone, welcome. So as I was saying, menopause is the point in time when a woman has not had a period for 12 months. The time before that is called perimenopause, and the phase after that is postmenopause. The average age of menopause is 52 years, but it can occur anytime between the ages of 48 to 55 years under the normal phase. Symptoms of menopause can begin anywhere from a few months to 10 years before actual menopause, which means that you can be in perimenopause as early as the mid 30s. All right. So I really like this visual to help understand what happens with estrogen levels throughout a female's life. So here in this chart, you can see that when a female is born during birth and childhood, there's low levels of estrogen. As we approach puberty, levels are erratic a little bit, and they increase until they hit our reproductive levels. And as we all know, puberty is kind of a crazy time in our lives. And then through the reproductive years, there's a relatively stable cycling of hormone levels, which helps produce our regular cycles and supports our reproductive process. And then as we get older, we go through perimenopause. And here you can see in comparison to puberty just how dramatic estrogen levels can be. They become very erratic, and then overall, there's an overall decline. And then as we hit postmenopause, they sort of flatline. This chart on the right also is another visual. It shows us like the changes in our hormone levels over a 6-month period. So you can see like in a premenopause female over 6 months, she has this very rhythmic cycling of the hormones responsible for menstruation and reproduction. As she hits perimenopause, this is what happens. Estrogen becomes so erratic, and which throws off all the other hormones, and it just goes kind of crazy until everything flatlines in postmenopause. So here I've just listed some of the symptoms of perimenopause. So we have some that are very common. We all know hot flashes, night sweats, brain fog. And then there's also some less commonly known ones that we're still learning a lot about. And these include things like cardiovascular disease, weight gain. Osteoporosis is another big field that's emerging as being able to benefit from hormone treatment. One sec. I'm sorry here. I'm having to admit, I'm just needed to pause to admit somebody, but welcome everyone who's joining the talk. So it's, the thing that's important with these symptoms, there's a huge list, and it's really important to be evaluated by a physician who can, it's really important to be evaluated by a physician who can kind of understand when did the symptoms start? How are they affecting your life? Is this something that is being caused by maybe a perimenopausal state, or are there other metabolic factors or other medical conditions that are contributing to the symptoms? So I'll just turn it over to Claire. So she's going to talk a little bit about managing perimenopause symptoms and how our lifestyle can help us.
Yeah, thanks. Yeah, like we just talked about, that is a huge list of stuff. And for me, I hope that you're here as like, oh, I want to learn about this, and not that all these things are happening and now you're feeling at a loss. But good on you for being here to support yourself and learn more. And I think that's the first step is recognizing what is going on inside of you. Some of the things on that list let's say that, like Dr. Kumar said, not everything on that list could be coming from the same spot, and they all can absolutely be affecting how you feel and your health in many different ways. So it's important to be thinking about that. And we do want to help support you in those symptoms and help you get to a place of feeling healthy, whether that be because your hormones are going crazy like we saw in that chart, or maybe some other things are contributing to it, because our whole life contributes to what's going on inside of us. That being said, and like highlighted here, there's no one size fits all. Like, you get to be the unique, wonderful person that you are. And sometimes that can be frustrating when you're looking at health, because there's no blanket statement to say, this is what's going to help. Or I shouldn't say that. Or like, this is what's going to cure you and make it all better, because everyone is so unique and different. But there are some principles that we can talk about that really help. And so one of the biggest things that I want to say, and this ties into the mental and emotional health, is have a support system. There are many of you on this call who I'm assuming are looking at this for your future or going through it. Find your buddy, find your sisters, your biological sisters, or else outside non-biological sisters who you can be in this together with and support each other and have a frank conversation and say, me too, and help each other with support and recognizing that you're not alone in going through this very natural process, although maybe not fun. It's a very natural process of going through this. And again, giving ourselves some grace and support here, of saying like, okay, yeah, there's some craziness going on inside of me. My hormones are going through a change, and that's okay. And it can feel a little out of control. Hopefully puberty wasn't that bad, but we've all been there. So we can remember that and then say, okay, well, we have some wisdom now that we can approach this a little differently. We can support ourselves the best we can in going through this process. So really doing the tools that you have in your toolbox, utilizing those tools, and maybe finding some new ones for stress management and managing your anxiety and stress. We all have it because we live in the real world. We don't live in a vacuum, unfortunately. So even without the hormones, life can be really stressful. So really leaning on your support system, finding your sisters, and using those tools in your toolbox, or tapping into a way to create more tools to lean on during this time, is going to be really helpful. Sleep was one of the things that was on that list. And sleep is so important to our health and the way our brains work, and just being able to be a functioning person in the world on a daily basis. And it can be really disrupted by our hormones, unfortunately. And again, all of our life responsibilities can disrupt our sleep. So again, finding ways to evaluate and support yourself if sleep is what's really hindering you and is maybe the main thing that's weighing you down right now. You can look at maybe some screen time usage, play around with that and see if it helps by decreasing screen time to help get into a better rhythm of sleep. Getting a new routine in place to get your body ready for sleep. Unfortunately, as we know, the only constant in life is change. So use what you've been doing, but maybe that needs to change for right now. And it might need to change again. So being willing to adapt a little bit and experiment with what can work to support you. Some other ideas around sleep is, getting more physical activity earlier in the day if you can help your body get ready to sleep at night. Getting outside. Today in Houston, it's raining, so we don't have sunlight, but getting some sunlight during the day can really help your body's natural rhythm of wakefulness and sleep. So again, there's a lot of little things that you can do and try out to figure out that recipe that's really going to work for you as your individual self. Like I said, physical activity. caveat, like we all know that all of these things are good for us, right? Like every person's going to benefit from stress management, good sleep, moving their bodies, and eating well. So no matter what you do in order to support yourself, like good for you, that's a step in the right direction. And then when you look at going into perimenopause and then that postmenopause phase, the way that your body composition is going to is going to be different because of how those hormones change. And again, so natural, expected. Dr. Kumar can really help navigate you through that change, but recognizing that your body is changing. And so again, your physical activity may look different and may need to be different for that. So be excited about that. Say, yay, I'm going to try something new. Be curious about these symptoms that are coming up and learning this new part of who you are. Something that's really important for women, all women, but like especially after menopause, is really supporting your bones and muscles because of how the hormones impact those. So adding in weights now, if that's not something that you normally do, and getting your body used to that, learning what you can enjoy about that and making that a habit, the sooner the better. And you can do a lot of different things. This doesn't mean that you have to go to the gym and just lift weights, but figuring out how to build muscle in a way that's going to work for you and be sustainable is really going to help you as you're aging through this whole process. Because that's really the goal, is that we get through this process with grace and as little issues as possible, and then continue on our lives in a healthy, vibrant way and really get to enjoy that and not be weighed down by these symptoms that can come up. So I put some resources together. These will be in the slides and emailed out, just some ideas of stuff that's on the internet. You know, the internet is vast. There's so much information out there. Some of it is great and some of it should be ignored, but you get to decide that. You're very smart people. Some things that I find really helpful are, some guided meditations can really help with stress and mindfulness. You don't have to meditate for hours a day, but getting in a practice of coming mindfully back and present and working on your breathing can help in so many different ways. And so these are the top two are some websites that can help you with that. Doing some yoga nidra can help with getting you ready for sleep and getting your body at rest. Also just tuning in and listening to what's going on inside of you and maybe figuring out where to go next. Stretching, moving that body, getting into the habit of movement more, and maybe differently. As we age, we get a little creaky. So stretching is really a great habit to get into. And then lastly, I put on here the Harvard Healthy Eating Plate. These are good general guidelines and good general spots to start. But like I said, remember that you are unique. You're going to have your own unique journey. So you're going to need to experiment a little bit with this and that and figure out how to help support yourself the best way that you can with what's going on with you personally. I'm going to hand it back over.
Thank you, Claire. Absolutely agree. From the day we're born until the day we die, our lifestyle and the stress and what we eat and how we exercise is just so important. So I'm going to talk now a little bit about hormone replacement therapy, which I'm sure is of great interest to all of you. So a little bit of background on hormone replacement in perimenopause and menopause. Medical treatment for menopause has been a little bit of a swinging pendulum over the years. Estrogen replacement was very common in the late 1900s. Then in 2001, 2002, there was this famous study called the Women's Health Initiative that was published by the NIH. And basically, they came out with this black warning that hormone replacement was terrible for all women. They need to throw it away. It causes breast cancer, cardiovascular disease, strokes, blood clots, just everything bad that you can think of. In recent years, however, that pendulum has swung the other way, and it's kind of come to the point where if you just consume a lot of social media, um, you may seem to think that estrogen is the cure-all and the answer to any age-related ailment. The reality, however, is that it's probably somewhere in the middle, and we're still learning a lot about menopause and the role of hormones in alleviating our symptoms. The research is continuously evolving, the guidelines are continuously evolving, and there's just so much change happening every day, every year in what we know. What we do think that we know, however, is that hormones are safer than we originally thought. And the risk of heart disease, strokes, breast cancer, it's less than or comparable to many other common risk factors like unhealthy eating or smoking or drinking a little bit of alcohol. Hormone therapy as a whole is thought to be safer and more effective in women if they start it within 10 years of menopause or below the age of 60. So what that means is that the benefits that we're seeing are greater when it started a little bit earlier. So like I said, unfortunately, there's no one size fits all and there's no formula that works for every person. It really requires an individualized approach, an understanding of the risks and benefits, and shared decision making with your physician. So what are the goals of hormone replacement? Basically, a lot of the experts in menopause like to use this gas tank analogy, what you can see here. So if you remember the picture I'd shown you earlier, you have these huge fluctuations in your levels of estrogen. One of the purposes of hormone replacement is to prevent you from going to empty on your estrogen. So your body may automatically take your estrogen level all the way up to an extremely high level, and then 2 days later, it'll drop to nearly zero. By replacing some of the estrogen through a supplement, through a medication, what we hope to prevent is not letting you go down to zero. And because when you do that, that can precipitate some of those really bothersome symptoms that women experience. So yeah, we want to improve symptoms, improve quality of life, and improve long-term health. Now, in terms of long-term health, there is the main thing I want to say, there is a lot of emerging evidence about how estrogen can be somewhat protective in the development of cardiovascular disease, also in helping women maintain bone density. There's actually been a lot of evidence to show that estrogen is such a powerful agent in helping women prevent osteoporosis. Similarly, replacement of estrogen has shown implications in preventing the development of dementia. So there's just a lot out there, a lot we're learning, and a lot that's kind of unknown still. So hormone replacement can be divided into two major categories. You can have systemic estrogen replacement and vaginal estrogen replacement. The most important thing I want to stress here is that there really is no algorithm and there's no official guidelines. So that also it's kind of an exciting. It's kind of an exciting place to be. It can also be a little bit scary. There's very few right or wrongs. And the perimenopause world of clinicians are just trying to be out there, getting women to feel a little bit better and do a little bit better than they would without any hormone replacements. So first, about systemic estrogen. Systemic estrogen can be given as a patch that you can put on your skin, a gel. There's also an oral version, an oral pill, a vaginal ring. Each form has its own pros and cons, which you can, kind of discuss with your physician. FDA approved estrogen. One thing that I wanted to stress was that FDA approved estrogen is bioidentical. And I'm bringing this up because a lot of over-the-counter products and compounding pharmacies, et cetera, will advertise their products as bioidentical, making a patient think that um, what is being provided through the regular pharmacy is something different. So bioidentical basically just means that it is identical to the hormone that we produce in our own bodies. And once it's replaced, we can measure the blood levels. So it's just something to be aware of, that what you're getting from your doctor is not any worse or different than a compounding pharmacy or uh, another provider who provides a bioidentical um, supplement. So systemic estrogen is used most commonly for hot flashes, mood lability, sleep disturbances, prevention of osteoporosis, migraines, joint pains. It is relatively very safe as far as we know. Side effects are usually pretty mild with estrogen. There can be a little bit of breast tenderness or vaginal bleeding, but these symptoms can be managed. Some relative contraindications, which we are still learning about, but and if you have any of these, I would just suggest you talk to a provider who is experienced and can kind of run through the pros and cons and the risks and benefits with you. But some possible relative contraindications are blood clots, breast cancer, a history of endometrial cancers, and abnormal vaginal bleeding that hasn't been worked up. So also just a quick note about progesterone. Progesterone is very important to be given with estrogen, and it protects our uterine lining and inhibits the growth of the uterine, the lining of the uterus. So progesterone can also be really helpful for sleep. So if you're coming in and you've always slept great, and now you're in your 40s and your periods are getting irregular and you're just not sleeping well at night, progesterone could be a great option to just help you sleep a little bit better. Side effects of progesterone are usually pretty mild, might be some nausea and bloating, but other than that, it's usually well tolerated. So the second category of hormone replacement is vaginal estrogen. So vaginal estrogen is generally a cream or a gel that is applied to the vaginal area. The great thing about this is that it is actually very safe to use in nearly all patients. There's very little systemic absorption. Therefore, if there's any possible risks of breast cancer, blood clots, etc., those actually don't apply to the use of vaginal estrogen. Vaginal estrogen is used most frequently to treat, frequent UTIs, vaginal pain, dryness, itching, frequent yeast infections, as well as symptoms with discomfort with sex. The most common prescription is a vaginal cream, which you take, which is prescribed once a night for about 2 weeks, and then thereafter it's used twice a week. So it's not something, there's no systemic absorption, and it's something that's really well tolerated. Okay, so I just want to take out a minute and talk about testosterone, which is the third hormone that is made by our ovaries. We all know that women make a lot of estrogen and progesterone, but they actually also make a lot of testosterone. All women have testosterone, and all women actually have more testosterone than estrogen. In fact, testosterone is a precursor to estrogen. So as we age, estrogen and progesterone levels decline, but so do testosterone levels. And what's fascinating is there are actually testosterone receptors throughout the body, and it's implicated in libido, arousal, energy, muscle mass, lubrication, etc. So testosterone replacement in women is an emerging field of menopause treatment. There's not a lot of official guidelines, and most menopause clinicians are becoming more braver and braver about, dipping their toes in it. It is approved. There is a global consensus statement that was published in 2019 for the use of testosterone in hypoactive sexual desire disorder, specifically in postmenopausal women. However, uh, although they mentioned using it in postmenopausal women, they didn't say that it's unsafe in peri or premenopausal women. It's more so that there's still evolving data, that the studies aren't complete, the safety, the efficacy, etc. Most testosterone is given as a cream, which is a systemic cream. It's a cream you apply on your calf or your arm, or it can be given intravaginally with less systemic absorption. Just a quick note, I know a lot of y'all have probably heard about testosterone pellets and injectable testosterone. The safety and efficacy of that, I want to say, is not well established, and most physicians and medical professionals will advise against using testosterone pellets, and that's simply because these modes are not FDA regulated. They're not approved, and there's not a lot of oversight about exactly what the dosing is, what the absorption is. So, and it's something that if you put a pellet in a woman and you have some side effects, you're not tolerating it, or it's too much, you can't really take the pellet out. So in that way, we always recommend going to a doctor and using formulations that are FDA approved. So some non-hormonal options, which can be used in women who have, a contraindication to hormones for some reason, or maybe you're hesitant to use hormones. These can also be used as an adjunct to hormone therapy. So for hot flashes, there is some good data for use of certain antidepressants, gabapentin. There's a medication called oxybutynin. Genitourinary symptoms, which are caused by the dryness and thinning of the vaginal area, can improve with hyaluronic acid. There's some laser treatments that you'll see out there, microneedling, which improve the elasticity and the collagen of the area. In terms of sexual disorders, there's two medications that are improved, Adi and Vyleesi, for females who are premenopausal. So if there's a hesitation to use testosterone, these are FDA approved and available. Both of them work slightly differently, but overall they increase dopamine levels and can be quite effective in improving arousal and desire and orgasm. In terms of migraine therapy, of course, we use anti-inflammatories, and then there's a class of medications called sumatriptans, which are widely used for their symptoms. So some over-the-counter and alternative remedies, which you have probably seen in the grocery stores, on Amazon. There's some websites that provide a bunch of compounded formulations. One thing I'll say is that a lot of this over-the-counter stuff is not FDA regulated, which means that safety and efficacy has not been established. So what can happen is you'll see things. So there's basically no oversight on the labels that are being put on these boxes. So you can have a jar of any supplements, like say magnesium, and there can be claims made about magnesium, but because it's being sold over the counter, these brands are not required to validate what they claim with scientific studies and evidence. But I will say, that being said, we can talk about a few therapies that are sort of some of the more common ones available. One is black cohosh, which has some data for hot flashes. It's not overall great data. but it's out there. And one thing about it is you do want to avoid it in anybody who has a history of breast cancer, because it has some estrogenic properties that we don't fully understand. There's a lot out there on social media these days about magnesium. So magnesium is a necessary element in numerous cellular functions and has been shown to have a role in maintaining bone density, cardiovascular health, muscle recovery, etc. There's not a lot of good quality trials on this topic, and overall, it's rather inconclusive. However, at the same time, it's generally considered a safe supplement, and so um, it may help you, but it probably won't hurt you as long as you're aware of some of the side effects and you rule out medical disease, like for example kidney disease, etc. Other alternative remedies include cognitive behavioral therapy, clinical hypnosis, mindfulness training. These are definitely have they definitely have good evidence in just supporting our lifestyle. Some of the stuff that Claire spoke about. Some therapies that are ineffective: evening primrose oil, ginseng, dong quai. You may have seen some stuff out there about wild yam. And over-the-counter progesterone creams actually are not effective in treatment of menopausal symptoms. Do we have any questions, Claire? I haven't been looking at the chat box. Let me see.
Sorry, I was muted. Yeah, we don't have any questions.
Okay, nothing yet so far. Okay, great.
Sorry.
So, getting support for your symptoms. So, I just wanted to talk a little bit about what I do. At Vita Family Medicine, we provide a comprehensive perimenopause evaluation. I'm a board certified internist and a menopause specialist. And basically, the evaluation is divided into 2 visits. The first visit is about an hour to an hour and a half, and we do a detailed intake with a history, past medical history, surgical history. We do symptom assessment, discuss your goals, discuss what's bothering you the most, and where you would like to kind of see yourself in the near future. Second of all, we do an in-person physical exam. So this does entail a detailed woman's exam, female exam, which is going to be a little different than your traditional gynecologic pap smear. But it really helps us see the health of the genitourinary system, and also check the pH, which is affected by perimenopause. Third of all, what we do is we'll kind of take all your symptoms and where you are in terms of your health and order some targeted lab testing. This can include hormone panels and any metabolic panels that might help me try to figure out the root of some of your symptoms. In the second visit, we can do this either in person or virtual. And what I basically do is try to provide you a more personalized treatment plan. And in that, I'll include what your options are for hormone therapy or non-hormonal options, as well as lifestyle adjustments. We also provide guidance on evidence-based expert advice. And so what that means is that we want you to be able to avoid spending, money on costly therapies or ineffective products that you might find in the, you might find at the grocery store or online. But we can kind of help guide you towards what might actually help you and be effective. Yeah, Claire.
Yeah, thank you.
So
Yeah.
I think,
I just want to, chime in and say, there are so many things out there on the internet, and that someone figured out maybe worked for them. But like we said, you're an individual and you're going to have to figure out what's going to work for you. But do that in a way that's smart and intelligent. See your doctor, see Dr. Kumar, get these panels done, get a really good comprehensive understanding of where you're at biologically and in your own person. And then you can go from there so that you're doing it in a way that's safe and productive. Like Dr. Kumar said, is like, yeah, there may be some things out there, maybe some little things that can help or big things that can help. And we don't want you wasting your time spinning your wheels and just feeling ill. Like we want you to feel really good.
Yes. Yeah, totally. Yeah, I love working with Claire. She's awesome. If you guys have any questions, can you please put them in the chat box? Also let us know, was this helpful, not helpful? Is there something else you'd like to know? Anything? We'd love to kind of hear some feedback because we want to do this talk a little bit more and want it to be useful for you all.
I've learned so much. Yeah, very informative. Yeah, it is shocking how little this is discussed.
Yes.
It's great that it's becoming more mainstream and unfortunate that we don't have more information, but cool that we get to be a part of learning all of this and learning more. So
yeah. And I think the hard part is, information overload. I mean, you just go through social media and it's so overwhelming and people tell you different things. You hear estrogen is good, estrogen is bad, testosterone is good, take magnesium, take vitamin D, take omegas, exercise more, do cardio. So I think, it's just so nice for patients to be able to find like a health coach or a physician that they can really direct their care, really direct all their questions to, and be like, okay, this is my one person. I'm just going to do what they say, and they're going to help me streamline everything and apply it to my life and help me implement my changes and hopefully, feel better.
Yeah. Brain fog is real.
Brain fog is real.
Brain fog is real. Yes. Unfortunately, that's one that we women deal with a lot from many different angles.
Yeah.
Many different.
And it's very difficult because the 40s are an age where a lot of women are just juggling so much. So anybody would get stressed and overwhelmed, and then throw hormones into that mix, and it's just crazy.
Yeah.
And that's where I think like your work, Claire, is so helpful because people need a starting point, like, okay, what are the small changes I can make in my life and how can I get them to add up to actually impact me, because sometimes, I mean, you can do hormones and it'll help, but like if your life is a crazy mess and you're working 12 hours or you're juggling multiple kids and you don't have, those lifestyle things in place, then the hormones are only going to do so much. So.
Yeah. I think that's such a good point. This has to be a multi-directional, multifaceted approach. In starting with some good foundations for education, Melissa just said, I think back to the mediocre education I had on puberty. Like, yes, we aren't us women out here entering perimenopause ages. We did not have good education on puberty. And so what can we learn and educate ourselves so that we can help our daughters, our nieces, the people coming behind us and understand how we can step into our futures a little bit better is going to be so helpful. And I think like Dr. Kumar and I are both really passionate about individualized care and looking at a person as someone who's going to be uniquely themselves and working with you during the time that it needs to take to figure out how to get you to where you want to be. And so we'd love to help you with that. and help you feel less alone and navigate to wellness.
Yes.